Hey, Billy, how do you get public schools to listen to allied health recommendations? You might have to explain that to me, mate, 'cause I don't know.
Yeah. So it goes back to the report bit I was saying that that's probably come from a family member that's like the therapists have said that this stuff needs to happen and it's not translating to school.
A therapist is an allied
Yeah, like a
health?
speech
So
pathologist, an
individuals-
occupational therapist, a psychologist. There's someone who's saying, hey, in the classroom, it goes back to the reflection we did.
Right.
In the classroom, he needs written instructions, he needs one-on-one support to step through each of them.
Right.
You know, he needs an environment that doesn't have noise, doesn't have distraction, is consistent and predictable and all this stuff. All this stuff that, I used to put in reports and be quite like assertive about it. The problem is, and I completely understand where that parent's coming from, because they're going, the therapist is saying this is the evidence-based intervention that needs to be happening across all environments.
What do you do?
So you go to the school and say, hey, like, how can I help you guys do this? Because the therapists are saying, and it can't be 20 things, it's got to be like, the biggest priority at the moment is their capacity to sustain attention for more than 5 minutes. The biggest thing we're focusing on is them succeeding beyond superficial peer interaction socially. The biggest thing that we're focusing on is the sensory overwhelm and how do they signal early for help. And you pick one of those things and then go to the therapist to saying, this is the thing that we're working on for the next month or so. How can I help this happen at school as well? Going and saying, hey, educators, there's a list of 20 things and I've heard only 19 of them are happening. This isn't good enough. It's just not a great approach. And I understand where it's coming from. And I've probably spoken about this before. I spend a lot of time in clinic with families that are really frustrated at schools because these recommendations aren't happening and saying...
Yeah, so maybe as a practical first step is when you get the long recommendation, not having to go at the allied health people, to be like, hey, what's the 1 to 2 things I should focus on and take to the school? Maybe just do that first, that you're dead clear and you don't have to try and distill 20 things, and the therapist to go, good question, I'd be looking at this one, you should see some uplift if you do this. And you go, epic, you go to the school then maybe, practically.
Yeah. And I haven't even told you yet, but we've got a different way that one of the long questions is going to be answered that I think will really help with this as well.
Oh, really?
Yeah.
Oh, Billy. He's chucking curveballs.
Sorry.
This podcast is brought to you by Guiding Growing Minds, a social enterprise that aims to give all children the best opportunity to reach their potential and succeed in living rich and meaningful lives.